We're speaking with Dr. Mark Wong, who's a hepatologist with Banner Good Samaritan. Thank you very much, Doctor, for answering our questions. We post a question to our website readers at jaderibbon.net and to our volunteers. If you had a chance to sit down with a hepatologist, ask him anything you wanted about hepatitis B virus, what would you ask? And they presented us with a list of questions, and I really appreciate you taking the time to answer that.
Anytime.
First off, is hepatitis B virus dangerous, and why should we care?
It is a dangerous virus because I consider hepatitis B virus as a silent killer. A lot of time you can live with the virus for a long period of time. You won't have any symptoms. You'll feel normal. It can eventually lead to cirrhosis or development of liver cancer. So by the time you develop these symptoms, it'll be too late. So therefore, I consider it a silent killer, and it is dangerous. You should care about hepatitis B virus because it is a virus that is easily suppressible, not curable itself by either taking oral pill once a day or injection once a week. So that's why.
I heard a lot of Asians have hepatitis B virus. Is this true?
That is true. They consider hepatitis B virus to be endemic in Asian population, in Asian country. Nobody really know why. But it is considered endemic versus in the United States it's considered epidemic when it does have an outbreak.
Is it a genetic thing?
Nobody really knows, but as far as I know, it's not a genetic thing at this time.
Should I get tested for hepatitis B virus?
Everybody should get tested for hepatitis virus, especially if they're high risk for exposed to the virus itself. The reason being because it's a virus that is totally preventable if you don't have exposed to it. By just getting a series of vaccination, you can prevent the virus from ever receiving it.
What is the test for hepatitis B virus like?
It is just a simple blood test. Normally, for somebody who at risk for hepatitis B, they should test for surface antigen, and that basically is testing for a protein that is on the surface of your liver cells that circulate in the blood, and they want to see if the virus does exist, and they can test for the antigen itself.
So there's a test and there's a vaccine. Who should get vaccinated?
Everybody who's at high risk to be infected with hepatitis B virus should be vaccinated. For instance, people who have sex with people who have hepatitis B virus, people who live with close contact with people with hepatitis B virus, people who's exposed to hepatitis B virus for many days should be vaccinated for hepatitis B virus because that virus itself is one of the longest living virus outside the body. Some people describe it can live up to 7 days outside the body with dry blood. So,
is there a cure?
There is no cure for hepatitis B if you've been infected for it because it is a virus that is considered DNA. So once you get infected with it, it's integrated into your DNA itself and it continues to replicate and your body immune system handle it differently each time.
What should I do if I'm diagnosed as having chronic hepatitis B?
First, you need to go seek care with your doctor and ask your doctor if they're experienced with dealing with hepatitis B and make sure they know how to interpret all the testing. If they don't deal with hepatitis B a lot, sometimes they don't know how to interpret it, then you can ask them if they can refer you to see somebody who is experienced at it.
How do I treat or manage hepatitis B?
Currently on the market there is two different drugs out there to manage, well, two different kind of drugs out there for manage hepatitis B. One is injection, which is once a week, and that's a set point from start to finish. And the other modality is oral pill, and there's so far I think 5 on the market out there, and that's just once a day pill. And each of them have different pharmacokinetics of how quick it lower the virus itself. So you really need to discuss with whoever giving you the drugs how experienced they are giving the drug and what is the indication, because all these drugs does develop certain resistance after you're taking a long period of time, and you really need to pick which drug you should be using and how much it costs to you.
If I feel okay, can I stop the treatment?
Absolutely not. You cannot stop treatment no matter how you feel. The reason why is because, like I said before, it's a silent killer. When you have the virus itself, you'll feel pretty much normal. And when you are on drug therapy, when the virus is low, you will feel the same. So stopping the drug therapy itself put you at risk for flaring your virus itself, and you might cause a robust immune response.
if I feel okay and I don't have, or I feel okay and I have chronic hepatitis B, how often should I visit the doctor?
It depends. A lot of times, my patient, I minimally want them to get blood tests every 3 months, making sure the virus itself did not resist to the drug. And if they don't have any resistance, I probably see them biannually, just two visit a year, and just do that, and they do okay. Until they develop resistant, then I need to see them more frequently or add drug therapy.
How do I protect my family?
You can protect your family, those who have never been exposed to hepatitis B, by simply obtaining vaccine. Once you get the vaccine itself, they are put for life of ever being infected by you.
Okay. Thank you very much.
You're welcome.